In our last hour on Wednesdays in the Washington Journal, we take a look at recent magazine articles as part of our Spotlight on Magazine series. This week, the cover story of Mother Jones, schizophrenic, killer, my cousin, from Newtown to my hometown, the insane cost of abandoning troubled minds. The author of that, Mac McClelland, is joining us from San Francisco this morning. Ms. McClelland, let's just begin with something you wrote inside the article. In the 1950s, more than 500,000 people lived in U.S. mental institutions. That's 1 in 300 Americans. By the late 70s, only 160,000 did, due to a concerted effort on the part of psychiatrists, philanthropists, and politicians to deinstitutionalize the mentally ill. Today, there's 1 psychiatric bed per 7,100 Americans. The motives behind this trend were varied, to say the least. What was happening in the 1950s?
Well, there was a lot happening, actually, when you talk about the varied motives. On the one hand, you had the fact that there were a lot of people in these hospitals, and a lot of people had noticed that the conditions in them were less than desirable or deplorable in some cases. So you had a patients' rights movement starting up where people wanted to get people out of these institutions and not lock them in there forever. At the same time, it was expensive to have people in hospitals, and people didn't want to keep paying for it. So there was sort of a convenient convergence of doctors on the one hand saying there's another way that we could do this, we don't have to keep people in these hospitals, and Republican governments, frankly, on the other hand, saying that's great. We didn't want to pay as much as it's costing anyway, so let's downsize this whole institution system.
You call it an insane cost of, quote, abandoning troubled minds. Give us an idea of your argument.
Well, for one, literally the cost of it. If you don't have people getting the health care that they need, then you end up paying for their illness in other ways. So, for example, in California, which was the pioneer of deinstitutionalization, just a year after they passed the act that kicked deinstitutionalization here into effect, the number of mentally ill inmates in the prisons and jails in California doubled. So if you're not paying for it in one place, you're paying for it somewhere else. Now nationally we see record, just sky-high numbers of mentally ill inmates in prison, so they've ended up institutionalized anyway. And then not just in terms of dollars, you have the cost of lives that are lost, both on the part of people who end up sort of lost in the system, and then they end up committing crimes, and then they end up locked away, but also their victims and the people that they hurt.
Inside the piece for Mother Jones, there's a sidebar story, Crazy Priorities. Approximately 10% of U.S. homicides are committed by untreated, severely mentally ill people. Chances that a perpetrator of a mass shooting displayed signs of mental illness prior to the crime, 1 in 2. Between 1998 and 2006, the number of mentally ill people incarcerated in federal, state, and local prisons and jails more than quadrupled to about 1.2 million. And here is the percentage of inmates with mental health problems as of 2004 in federal prisons, state prisons, and in local jails. So what is the impact of all of this on prisons versus having mental institutions like they did in the 1950s?
Well, basically, you still have people locked up, except instead of being locked up in a facility that's meant to take care of people with their issues, you have people who are locked up in prisons by corrections officers who are not trained to deal with and treat, obviously, mental illness. And so you end up having a lot of problems. There are a lot of suicides of mentally ill in prison. There can be altercations with guards that end in people getting hurt, sometimes that end in people getting killed. So the corrections officers have sort of become de facto mental health wardens, and that's not their job, and they don't have the training to do it.
How much is the federal government spending on mental health?
Well, not enough, actually. when they started this plan for deinstitutionalization, the idea was if you get all these people out of institutions, we can just give them help within these community centers. So they would still have a place to go, they would still have places where they could get help, they could get medication, they could get treatment, they could get therapy, but those mental health centers never came around. In 1980, Jimmy Carter, even in 1980, the funding was so subpar that they wrote this new act and signed it into law that they were going to step it up so that we had enough money to actually take care of all these people who'd been, hundreds of thousands of people we're talking about, who'd been just dumped out of institutions and weren't getting care anymore. But then when Reagan came into office, you know, he totally gutted it. And so the money was actually never there. And for decades, we've been scaling it back and back and back year by year.
And how is where does the mental health spending go? How does it break down?
Well, for now, it's mostly up to the states. You have all of the burden, almost all of the burden has been shifted to state and local governments. And it depends on the state, what state you're in, how much they spend. You know, you have some states that spend $150 per capita on mental health care. You have some states in Ohio, which is where I was born, you know, there's the county that Cleveland is in spends 20 cents per person, and that's, you know, obviously an abysmal amount. So it sort of depends where you are. But in all cases, most of the money goes to drugs, just loading people on prescription drugs. And prescription drugs are a really important part of treatment for a lot of people with mental illness. Schizophrenics need antipsychotics in a lot of cases, but it's not the whole answer. Obviously, they need a lot of other kinds of treatment and support.
And you do a comparison in your piece, how the money was being spent or where it went in 1986 versus where it will go in 2014. And you can see prescription drugs is in brown, and you can see very little spent on that in 1986 compared to how it is being spent now. Talk about the trend and the changes over time of the breakdown of how the money is spent.
Well, you can see in that chart the money used to go to hospitals. So most of the money was going to hospitals and keeping people, not always, again, it's not that hospitals were the great answer. In a lot of cases, the conditions were terrible, and people weren't even trying to get them better. They were just trying to keep them sort of locked away. But in some cases, people would go into hospitals, they would have kind of a stint there, they would get treatment, they would get support, and then they would get out and they would move on with their lives. Now that is very rarely the case. It's very difficult to get into a hospital because there aren't that many hospitals. As you mentioned, there's one bed per more than 7,000 Americans, and so pretty much your only option and where all the cash is going is to just get on drugs. If you want actual treatment, especially if you want inpatient treatment, it's extremely difficult to come by.
And you talked about how it varies across the country, and inside your piece you have a colored chart of the United States. The states in blue are spending $75 or less per capita on mental health. The states in green, $76 to $105, and the states in red are spending about $106 to $160, and the tan states, 161 or more on mental health spending programs. This information comes from the federal agency that oversees mental health issues. What is that agency? What do they do?
SAMHSA.
Yeah.
Well, it's a board basically of the federal spending, and it's not just mental health. We should say that that's also substance abuse treatment is included in there because those issues are often concomitant, but they're sort of the overseeing board, and I interviewed someone who's on that board for the piece, and they, like everybody else, are basically saying, you know, we don't have nearly enough money to do what we need to do. People are just sort of falling through the cracks, and we're ending up paying for it in different ways. So it's not cost saving to not give them the resources that they need, and they know it, and they've known it for a long time.
Also, another chart that's in your piece, the true cost of abandoning the mentally ill. Between 2009 and 2012, States cut a total of $4.35 billion in public mental health spending from their budgets. And according to a damning report by the National Alliance on Mental Illness, these 6 states and the District of Columbia have cut spending more than 20%. That's South Carolina, Alabama, Alaska, Illinois, Nevada, California, and D.C. First phone call here from Mac McClellan. Chris in Nashville, Tennessee, independent caller. Hi, Chris.
Hi. I have a question. Basically, it goes back to your previous guest who was studying the urban poverty, and that coming into this guest with Mac. You know, I'm bipolar. I've had panic attacks my entire life. I've been hospitalized several times for these. I'm a professional hairstylist. I've had times in my life where I was making $75,000 a year, and now I'm completely unemployed because the public health care system here in Nashville, Tennessee is almost impossible to manage. You can go to an office and they'll tell you, well, they'll assign you to someplace that's so far away from your house that it's ridiculous to get there. It becomes almost impossible to get. It's a breakdown of systems as the systems move out of the cities and into the more urban areas, and it's very, very frustrating. Sometimes just trying to navigate the system is enough to actually make the problem worse, and it's been my own experience for myself that I have to really stay on top of things to stay motivated to try to manage my mental health care. When things crumble or when things break down or I can't access the care, it creates a tumbling effect. And I know that there are many millions of Americans that are in this category where they have high earning potential, but they can't make it because when I fall into these deep depressions, I can't check email. I don't answer the phone. I'm not able to function like a normal person. That's all I have. Thank you.
Mac McClellan, your thoughts on what you heard from that caller?
I mean, unfortunately, that's not an uncommon story. When, you know, one of the people that I interviewed here runs a community mental health center in the Tenderloin, which is a neighborhood in San Francisco that's 35 square blocks, but has 6,000 homeless people in it in any given day. So when I was talking to her, she said, you know, most of the people who come in here who are trying to get assistance, they have treatable mental illnesses that, in theory, if they had a little bit of treatment, they would be fine. You know, they wouldn't be in sort of this downward spiral of you lose your job, you have to try to get on disability, you can't, or there's a delay, you end up homeless, you end on a waiting list for an emergency shelter, where in San Francisco that list is so long that they've shut it and they're not even taking names anymore. So a little bit of money in treatment goes a long way in terms of saving money and sort of saving people from these downward spirals in the end, but they often can't get the support that they need, even when they have, in the case of the caller, something that is treatable and manageable if you can just get the necessary assistance.
A tweet for you here from one of our viewers who asks, where in the Constitution does the federal government have the authority to deal with medical issues of mental illness?
Where in the Constitution? Mm-hmm. I mean, it's sort of it's a basic human right. It's a basic civil right to have access to medicine that somebody needs, isn't it? And also, it's a matter of protecting people from themselves and from others. You know, like the amount of crime that a lot of people think, frankly, is predictable and preventable with people who are mentally ill. You know that they're in trouble, you know that they're in sort of a bad state, and you can see the sort of downward spiral happening. You try to get them help, you can't get them help. We've seen this with some very high-profile cases lately where, you know, the perpetrators of violent crimes their families have seen warning signs, they've tried to get them assistance, and they can't. In terms of getting those people, you know, the best quality of life, and in terms of safety, I mean, this is a huge, huge issue for not just for the people who are suffering from it, but for everybody around them.
Ron, Burlington, Vermont, Democratic caller.
Yeah, good morning. When Irene came through here in Vermont, it wiped out our state hospital. And it was never rebuilt. So, you know, we're hunting for beds everywhere. But, you know, Dr. Peter Breggin after his 40 years of working in this field, has come to the conclusion that neuroleptics and drugs aren't any better than any other treatments, and the cost of all the medical complications from these neuroleptics are just terrible. And another person that people might want to look up is Will Hall, a schizophrenic who, now has gone back to school and gives lectures across the country. He lives with his voices. And this is done without medication. And I think what Vermont has done is they're trying to get the Finland approach, which doesn't use neuroleptics for schizophrenics. And they have an 85% cure rate. After 5 years, there's no relapses.
Okay. All right. Mac McClellan, your thoughts?
You're right that there are a lot of side effects with the antipsychotics that they put people on. There have been several members of my family who have been paranoid schizophrenics, and they certainly can attest to the side effects, but they also do help a lot of people. On the other hand, I'm familiar with the sort of models that you're talking about where you don't use drugs and you try to basically empower someone to deal with the voices that they're having and rehabilitate them in other ways. This country, unfortunately, is way behind in those models. When I was reporting this story, I did go to a farm, actually a working farm in Ohio, where they have severely mentally ill people who they do put them on medication, but for the most part they try to get them more prepared to deal with society and get their global functioning up with farm work and sort of being integrated into this community, and they have super high success rates. That model was perfected in Europe a long, long time ago, and we're just sort of starting to see a resurgence of it, and it is cheaper than your sort of standard institutionalization models, but unfortunately Medicare in general doesn't cover it yet. So hopefully that will be things that we'll see people moving sort of in that direction, and the policies will support people getting it, because right now care like that you're talking about is private care, and so if you have a ton of money you can get that, but if you don't, it's frankly just not available to you.
So the working farm was a private company, private business.
That's right.
And so how did the mentally ill that were participating in this voluntarily go in, family access this? How does it work?
Yeah, it was voluntary if they wanted to go, and if their families were, it was the decision that they and their families had made together that it would be a good place for them. None of these people were, sort of being dragged in there and locked away against their will, and it was beautiful. It's this sort of very pastoral range, and they have these gorgeous Belgian horses and things like this. And the people there, I talked to some of the people who stay there. We all had lunch together. They all have lunch together every day, and they all seemed like they liked it. But yeah, it was because they had parents or other family members who had a bunch of money who could put them there.
And how much does it cost, that sort of thing?
That was a couple $100s a day. I don't remember exactly, but it might have been like $500 a day.
Robert, Austin, Texas, independent caller.
Yes, this is. I've been a special ed director, and I also have family members that are schizophrenics or having mental illnesses. And I've always been a wonder that in so-called a Christian state that we have mistreated the mentally ill here in Texas horribly. We put to death retarded people, which is horrible. That there's no way that can happen. And the question that bothers me is, we're supposed to be Christian, and I'm a Christian. And in Christ is what we do to the least of our neighbors, you do unto me. And we're not living that way. We have a political party which tend to be very conservative that have taken away, it started with Reagan, like you said earlier, taken away all the special ed institutions and put them out in the streets in California, where they had to put them on buses, because I was a director at that time, but they put them on buses and shipped them all over the United States. Now, is that Christian? I love Reagan. After he did that, I had nothing to do with him.
All right. Mac McClellan.
Yeah, you're right that it's kind of a measure. You know, some of the experts I was talking to, it's sort of a measure of how we're doing as a society, and in terms of just basic humanity, if we are completely abandoning people who are really vulnerable and who really need assistance, and just sort of leaving them to the wolves, which in this case often ends up being on the streets or in prisons. And again, the thing about it, you know, people don't have money, right? Governments don't have money. They have to scale back. We're having all these huge economic issues. But when you do the math and you work out how much it costs to actually treat these people versus how much it costs not to, it's not saving anybody any money to not offer them treatment. One of the guys at the California Psychiatric Association that I talked to for this article was saying $2,000 or $3,000 worth of treatment saves $50,000 in jail. So it's not just, you know, a matter of humanity, but in terms of saving money and budgets and things that, you know, people seem to really care about, it makes so much more sense.
R. Harrington tweets in this for you. Mac McClellan, Mother Jones, don't we need to evaluate the homeless population in this group?
I'm not sure what they mean by evaluate the population.
Just tying mentally ill to the homeless population. What needs to be done there?
Well, I mean, people know that a lot of the homeless are mentally ill. The estimates are that it's about 30% of the people that you see on the streets are seriously mentally ill. Again, this is a population that if you got them treatment and got them assistance, that wouldn't be the case. You know, homelessness exploded after deinstitutionalization because people were sort of let out onto the streets after being in institutions for a long time, and then there was nothing to take care of them and no support when they got out. So mental illness is definitely a huge, huge factor in the super high homeless rates that you see right now.
We're talking with Mac McClellan. She's a contributing writer to Mother Jones, wrote the cover story, Schizophrenic Killer, My Cousin, talking about, as she says, the insane cost of abandoning troubled minds. Sharon, you're next in California, Democratic caller.
Good morning.
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 I was calling. I'm concerned about this issue, but from somewhat of a different angle, and I'm wondering if you did any research on this aspect. The CDC just recently came out with a report that said 1 out of 5 U.S. children have mental disorders. That's 20%. And some of these children are being treated with, attention deficit disorder drugs. And I'm wondering if you looked into looking at environmental causes of neurocognitive difficulties. The Poughkeepsie Journal just ran an article about people who are having neurotoxic difficulties from Lyme disease, Lyme exposure, and it was horrible. They got these emails from the federal government that showed the National Institute of Health was referring to these people who are sick as Lyme loonies, and, they've been screaming for help to get physiological and physical treatment, and they're being misdiagnosed as mentally ill when an environmental doctor helps them. I'm wondering, did you look into that aspect at all of, the cost of mental illness in this country?
In terms of causes, unfortunately, there's not a lot of consensus with most mental illnesses. It's hard to say. With schizophrenia, you will have people, and they've been studying this for decades, you'll have people who will say it's, you're born with this hardwiring in your brain and it's destined to happen at some point in your life no matter what. You have sort of some new, more progressive research that's saying that there are a lot of environmental factors, social factors even, that make a huge difference. There's no one answer, and there's no true, obvious answer that you can apply, unfortunately. But they do know that you can treat most of this stuff and that it makes a big difference in the way that you treat it. So while the causes aren't always clear, and they may not be clear for a really long time or ever. It's super hard when you're talking about, you know, these disorders of the brain and things that don't have biomarkers to sort of pin down a cause. But we know what the effects are, and we know what the treatments are that work. And so, you know, focusing on that could solve the problem kind of no matter what the cause was to begin with.
What motivated you to write this story?
We wanted to do a piece about the mental health budget cuts that have been happening. You know, states in the last 3 years have cut more than $4 billion from their mental health budgets, which is an astronomical amount. And as I mentioned before, there are several members of my family who are schizophrenic. My aunt, my mom's sister, I grew up with her. She was schizophrenic before I was born and for my entire life. And then, as it turned out, I had a cousin who was in jail for having murdered his father, and he was never diagnosed before that, but once he got into jail and he saw a whole bunch of psychiatrists who were evaluating him, it turned out that he was schizophrenic as well. So it's not just an abstract sort of issue of cost and things like that. In my family, you know, I know what the cost is, and too many members of my family can say all too well what the greatest costs are. I mean, it costs my uncle's life and my cousin, who is going to be institutionalized for a long time or possibly forever because of what he did. So, you know, it just turned out that my family is just one family of countless families who have been impacted by this total abandonment of the mental health system.
What was it like for your family to try to access mental health for those in your family?
Well, it was a lot easier a long time ago in the 70s when my aunt had her first psychotic break. My mom called her family doctor, and her family doctor said, take her to this special hospital, you know, down the way, and she took her to a psych hospital, and that was that. And there were a bunch of psych hospitals in Cleveland at that time. That was in the 70s. And that was what you did then, you know, if somebody was having a nervous breakdown or somebody seemed like they needed some kind of mental help, you took them to a psych hospital, and you knew that that was there and that was your option. In terms of my cousin now, and this was just about a year and a half ago, his family saw a lot of warning signs. They knew that there was something wrong with him. He was acting totally different. Now, in retrospect, he's been diagnosed as having a classic case of an onset of schizophrenia. He had all the typical symptoms, but they could not find help for him. They live in Sonoma County, California, which has no psych hospital, and they couldn't find a place to take him. And that's unfortunately very common. You know, half of the counties in California don't have psych hospitals, and so the only way to get into a psych hospital, where there are so few and they're not near where you live and they're over full and they have wait lists, is to get arrested and get thrown into one. And unfortunately, my cousin didn't do anything wrong until he did something spectacularly wrong, and somebody ended up dead.
Mac McClellan, we're showing our viewers, as you were just talking, pictures of abandoned mental institutions that your colleague took. Can you talk about these a little bit?
Yeah, that is a photo project that our photographer was working on for a really long time. He was sneaking into abandoned mental institutions, basically, and taking pictures. And they're kind of amazing. You can tell from these pictures how hasty the emptying of these institutions was. You know, it's like people just walked up and got out one day and left everything behind. There's files all over the place. People's toothbrushes are still there. They are really spooky, but they're kind of a very powerful image that shows how fast this happened.
The photographs that accompany this story are part of an ongoing project called American Asylum's Moral Architecture of the 19th Century. Jeremy Harris has been photographing these abandoned institutions over the past 8 years. You can see more of the images at motherjones.com. Chris, you're next in Wyncote, Pennsylvania. Independent caller, go ahead.
Hi, and good morning. I wanted to say, first of all, thank you for writing about this and speaking about this. I was a former public health student in Philadelphia, Pennsylvania, where I just graduated, and now I'm going back to school in Montgomery County, Pennsylvania, which is neighboring to Philadelphia County. And I studied a lot of mental health, and I found that a lot of people generally don't like to talk about it, whether it's because of taboos or whether it's because of the social factors you talked about or just the complex nature of it. And my question for you is twofold. One is, where do you see the future of mental health under the Patient Protection and Affordable Care Act? And my second is, you were talking about how the block grants and the budget cuts were taking place. And Pennsylvania is one of those, unfortunately, under Governor Corbett, who seems to not care about mental health. And so I'm wondering is, how do you see that taking a toll on the future of mental health services, especially like with Medicaid services in Pennsylvania or Texas or Ohio, et cetera? Thank you. And
well, again, it's sort of, in terms of Medicaid, it kind of depends on the state. You know, all these states have taken on the burden, this enormous burden of cost. I don't mean that the people are a burden, but the cost is a burden, and it's shifted to state and local governments, and the amount, all those issues with Medicaid, the way that they cover, and, you know, the expansion, for example, in Ohio that they're proposing now, because they cut it back so far that they're, you know, even the very Republican governor of that state said, you know, we're at a crisis point now with mental health care, so they're looking back at expanding it. It kind of depends on where you live. In terms of the Affordable Health Care Act, you know, if just in the last 3 years we've cut more than $4 billion out of the state's budgets, access to health care is, in a lot of cases, not these people's problem. It's not that they don't have insurance, and it's not that they can't get Medicare or Medicaid, but it's that the facilities don't exist for them to go to. So even people who have insurance can't get the assistance that they need. So, I mean, for example, you know, I have health insurance, but my health insurance, and it's good health insurance, but it covers, I think, 6 sessions of therapy per my life or something like that. So obviously people getting insurance is a great step for a lot of things, but it is not, having insurance isn't enough to make up the gaps in the care that we have in this country. And it's a point you made in the article, and the part that we started with at the beginning of this conversation, that in the 1950s, more than 500,000 people lived in U.S. mental institutions. That's 1 in 3 Americans. Today, there's 1 psychiatric bed per 7,100 Americans. And you talk about the motives behind that trend. Bill, in Washington, D.C., Democratic caller. Go ahead, Bill.
Yes, Mac. First of all, I'd like to thank you for the book you did on Burma. I think you made a positive contribution to the progress that's been made there in the last year or so. In order to solve this problem, Congress created this problem, and Congress can solve the problem. And in order to affect Congress, Congress responds to groups of people. So could you tell our audience what groups of people they should be getting in contact with in order to pressure Congress to reinstitute these psychiatric hospitals and solve the problem? In order to solve this, we have to act not individually, but as groups. Thank you.
You're right. The Congress could solve it. Congress did actually solve it, you know, when they wrote the act to step up the funding for community mental health care centers, when they realized that there wasn't the support that was supposed to come after deinstitutionalization, but you know, again, it ended up gutted and it never happened. Reinstituting something like that could go a long, long way. And again, you know, it's easy to say, oh, if we just had billions of dollars, we could solve this problem. You could say that about pretty much anything. And you know, it's a time of tight budgets, and we just don't have money to throw all over the place. But if people would actually look at the costs of treating versus not treating, and the way that it's, I mean, they're going to spend the money anyway. They are spending the money anyway, but we're spending it on prisons, and we're spending it on crime, police forces. You know, my cousin, who is in jail now waiting to be moved to a state facility, will be in a state facility possibly forever. Just a year in jail cost $50,000, not to mention the cost of his trial and police time and judges and court and things like that. So it's not cheaper to not treat them. And I think if that connection was the way that people talked about it, because unfortunately that's not the way that the math is done. That conversation is just, we need to save money. We can save it by cutting all of these expenses from the mental health care budgets. But that's not true. And if this conversation was had in a more realistic way, like, okay, if we cut this from here, this is what it's going to cost in jail and prisons and other sorts of issues, then I think that that sort of reframing could make a population that people, a couple of callers have mentioned, you know, the mentally ill are not a valued population in this society. People think that they're sort of worthless and they're just a drain on society and they can't lead productive lives and things like that. So, you know, it's not true. If you get them the treatment that they need, then they will end up costing much, much less in terms of dollars, in terms of lives, in terms of crime and homelessness in the long run.
Mac McClellan wrote the cover story for Mother Jones magazine, The Insane Cost of Abandoning Troubled Minds. She's also, as that caller referred to, an author of a book, For Us, Surrender is Out of the Question, a story from Burma's never-ending war. If you want to follow her, her website, mac-mcclellan.com, also on Twitter at Mac McClellan. We'll go to Greg next in Sarasota, Florida, independent caller.
Oh, hi. Hi, good morning. I think if you would like to see something to explain what those people sitting on the side of the road as they all walk by, you might try Schizophrenia Explained. It's on YouTube. It's an educational video. It'll take a precious 20 minutes of your time. Start at 9 minutes and 30 seconds, and you see what goes through the minds of people. And the second is Clozapine. That drug costs $20 for a week, and it's the nearest substitute in our highly funded drug industry is $180 a week. So do the math again and again, and you'll see there's only a few things wrong with that drug, Clozapine, but it's black label. Now, that is an incentive anyway for you, dear, to, and you probably do know that, but explain that to people how a drug that would work, that can be given in suicide situations, that will take away the suicidal pangs, and also deal with different issues such as cognitive memory disasters and working memory disasters when the outside stimulus is so strong that you can't even see straight. Thank you.
Mac McClellan.
Actually, that's interesting. That video that he mentioned has been recommended to me before. Actually, after my cousin's murder trial was over, his lawyer was recommending it to people to sort of give them a better idea of kind of what it's like to be schizophrenic, because people are scared of severely mentally ill people. You know, they think that they're sort of unpredictable and unhinged and don't know what's going on, and it of course is a lot more complicated than that. And I, you know, grew up with schizophrenics in my family, obviously, but learning a little bit more about it is definitely a good way, a good first step to removing some of that stigma. It's not as scary as people think.
Ed in Canton, Georgia, independent caller. Hi, Ed.
Hello. I'm really happy that you made the point about the prison system ended up taking up most of the slack in our mental health system, or lack of mental health system. But I'd like to make the point that if we could spend some money, or actually we spend a tremendous amount of money on education, but whatever it would take to identify the kids with issues, we could stop so many things. You can identify them. We could follow them through, high school and even college, where a lot of these problems come from. The kids, the young girls commit suicide. The boys kill people before they kill themselves. And I think if we did that, we could also stop some of the violence in the inner cities if we just identified these kids early on.
I think that's right, and early screening is definitely an important part. It's not a thing that we do now. We screen for lots of stuff in schools, but we don't screen for mental illness in most cases, and it could make a really big difference. Again, when I was talking to this sort of this area in downtown San Francisco where the crime is sky high, it's the most violent neighborhood in the entire city. There's a lot of homeless people, there's a lot of addicts who live on the streets and things like that. The director of the Community Mental Health Center there was saying, most of the people who come in here are sufferers of PTSD. They have post-traumatic stress disorder, and not because they're veterans, because something very serious happened in their childhood. So this is an old trauma that causes a lot of problems and can cause problems for decades or for life. If these were things that we were screening for, if childhood trauma was the thing that you looked for in schools and treated, you could save a lot of substance abuse, a lot of later violence, a lot of later social problems and things like that. Most of the people who are going into this clinic for help have a highly treatable disorder that they've had for a very, very long time, and that could have been caught earlier. The other thing is, with things like PTSD, the longer it goes, and schizophrenia, bipolar, the longer you let it go without any treatment, and sort of the more trouble that the person gets in, the more isolation that they end up with in terms of being ostracized from society and alienated from friends, the harder it is to treat. So the longer you let it go, the more expensive and more problematic it becomes. So early screening could do a lot to take care of them.
Mac McClellan, you talked to a lot of different people. You went to different places and visited with the mentally ill and different programs that are out there. What did these people tell you about what they need, what they want from state government or the federal government?
Assistance, I think, would be the key. A little bit of validation in terms of, not being scared. If you ever interview homeless people who live on the streets, what they will tell you is that, sort of the worst thing about it is how many people will walk past them and just completely ignore them and pretend like they don't exist. And I think a lot of the mentally ill, both in my family and otherwise, feel like people just don't pay any attention to them and try to pretend like they don't really exist. And that kind of isolation really can make a problem worse, in addition to just being totally dehumanizing. So a little bit of humanity in addition to a little bit of assistance. And I think that one follows the other.
All right. Mac McClellan, contributing writer to the Mother Jones cover story, Schizophrenic Killer, My Cousin from Newtown to My Hometown, The Insane Cost of Abandoning Troubled Minds. Thank you very much for talking to our viewers this morning. We appreciate it.
Thank you.